So, good morning, Miss. I'm Christine Angel A. Bata, student nurse from Mate Doctors College, and today I'm going to perform a written demonstration of tracheostomy care. First is to greet the client and introduce yourself to gain a trust and cooperation. So, good morning, sir. Ako si Christine Angel A. Bata, student nurse sa Mate Doctors College. And karon sir, mag-perform ko og tracheostomy care sa imo para ma-maintain ang cleanliness and to avoid infection and to maintain the airway pattern. Is it okay, sir? Okay, thank you. Next is to perform hand hygiene to minimize microorganism and provide privacy. Hand hygiene. Assuming that I already provide privacy to the client. Next is to prepare the client and the equipment. Position the client in a semi-fowler or fowler position to promote lung expansion. Sir, position the client to semi-fowler. Is it okay, sir? Okay, thank you. Open the tracheostomy kit or sterile basin and pour the soaking solution and sterile saline into a separate container. So, muna siya akong dara ang akong sterile saline water. Pour in soaking solution sa butang na separate container. Next, also open the other sterile supplies including the sterile applicator, suction kit, and tracheostomy dressing, ensuring that all items remain sterile throughout the procedure. Magbutang ako daan og clean gloves. So, sanction the tracheostomy tube, put on clean gloves on non-dominant hand, and a sterile gloves on your dominant hand. And sanction the tracheostomy tube to clear secretion. And rinse the suction catheter, then peel off the glove inside out over the catheter. Next is to unlock and gently remove the inner cannula, placing it in soaking solution. This moisten the loosened solution and remove and discard the soil dressing using the glove hand. Sir, tanggalan ako ni sir ha, mugunit ko. Next is to put on a sterile gloves. Next is to clean the inner cannula and remove the inner cannula from the soaking solution. Clean the lumen with a brush or pipe. Cleaners moisten with sterile saline and rinsing the drying only inside and not the outside. Then after the gently tap of the cannula against the inside the edge of the sterile saline container, use a pipe cleaner fold in half to dry only inside of the cannula and do not dry the outside. This removes the excess liquid from the cannula and prevent the possible aspiration by the client while leaving a film of moisture to the outer surface to lubricate the cannula for reinsertion. So, wala ako'y kuan, assuming that this is a brush. Discard and tap. Next is to insert the inner cannula aligned with its curvature. Lock it into place to secure it in the outer cannula. So, para may balaan mo siya nga, nalock na siya click na madungog. Sir, butan ako balik. Next is to clean the incision site and tube flange. Clean the incision site with sterile saline using single-use applicator or gauze. And this avoids contaminating a clean area with a soiled gauze dressing or applicator. And if needed to use, have a strength hydrogen peroxide mixed with saline to remove crust. Then rinse thoroughly the hydrogen peroxide can be irritating to the skin and inhibit the healing thus inhibit irritating the skin, inhibit the healing, naturally remove. Then clean the flange of the tube similarly. Then dry the skin and tube flange with dry gauze square. So from inner to outer, discard, discard, discard. Then, assuming ano na ako siya. Then, apply a sterile dressing. Apply a sterile dressing. Use a non-revealing tracheostomy dressing or a fold 4x4 gauze into a V shape. Kani. Ano siya? Cotton lint or gauze fiber can be aspirated by the client, potentially creating a tracheal abscess. And place the dressing under the flange of the tracheostomy tube while ensuring it is supported. Then, while applying the dressing, ensure that the tracheostomy tube is securely supported. So, sir, magbutang ko ani sir ha. Next is to next is to change the tracheostomy ties. Change the tracheostomy ties. Change ties as needed to keep the skin clean and dry. Use tape or Velcro ties. Velcro is preferred for comfort and less abrasion. Sir, kanang mag-ilista og ties sa imong answer ha. Sir. Then, discard. Ibalik din ako ang oxygen mist. Oxygen ni siya miss. Wala na nabutang kaya di nakaabot. So, siya. So, this is the end of my return demonstration of tracheostomy care. Siya miss ang oxygen.